Hi, good evening. It is 12/13 of 2023, 6:06 p.m. Calling to order the meeting for Monroe for the Board of Health. Um, we will hold on. So we will call to order. At this point, we do not have any other public participation that I know of. So we will move right on to the next item on the agenda, which is the approval of the minutes from our last meeting, which I will vote to approve at this point.
Mike will second it.
Okay. Lax and Amy vote.
Yes. Taylor.
Okay. All right. Carried unanimous. Next items will be all Amy. So let's rock and roll.
All right, awesome. So for the Director of Health report this month, just three things to highlight. We did attend the MASIC event with Chris Herron with the night before he spoke to the kids at MASIC, all about drugs and drug prevention. He was a very moving speaker. It was very real what he was talking about. I actually brought my daughter who's in 8th grade and she got a lot out of it. So it was really cool to see. But the health department was there with a table. We were giving out doTERRA bags, which are to get rid of prescription medication in a safe way if you can't make it to a medical drop box like the one at the police station. We were also doing information on vaping, opioids and fentanyl, as well as cannabis. So we had a table set up. It was pretty well received. We also gave away a free lockbox, so you could lock your prescription medication up at home so that nobody could get into it by accident. We were also pushing the lockboxes for anyone who may be doing any sort of cannabis, especially edibles, and that may have young children in the house to keep them separate so that there's no potential risk for kids getting into it. The next thing we're looking forward to is in January. It is Radon Awareness Month, and we are again going to be giving away free radon test kits and doing a radon presentation at the library. I believe that is January 10th, which is actually the night of our next Board of Health meeting. But if you guys are looking for any free radon test kits, we will have those available. And finally, our workforce development grant, which we have talked about a little bit before, was fully executed through the town council and signed by Terry today. The date for that was November 1st of 2023 to November 30th of 2027, and it was about $43,000. So we will be beginning to spend that down in the next 4 years. For the environmental health activity report, we are right on track where we're supposed to be. Septics were busy this month. The amount of rain we've had this fall has definitely not helped some of our septic systems. So we have had quite a few repairs that are due to pretty wet conditions out there. One of the things I did want to mention in the environmental health activity report is that the projected numbers that are over to the right-hand side, I did not prepare those. Those are actually from Nancy. And so when I started looking at them today and seeing some of the numbers and some of our percentages, they're all kind of out of whack. So I don't know if you want me to go ahead and try to fix that now mid-year, or if you'd rather just wait till the next fiscal year starts. Or it doesn't matter to you guys anyway, so that's fine too.
Yeah, I don't foresee that being any kind of issue at this point.
Okay.
Those were kind of like average numbers and so forth. Kind of like when we did budget stuff, kind of used like yearly averages and so forth. And I think her and I had talked about it a little bit. We had reduced some of the numbers due to COVID and so forth, with multiple businesses closing and whatnot. So I wouldn't worry about it a whole lot. Obviously the percentages are the percentage. I know when I look at it, it's like, if I'm looking across the numbers, they're all fairly consistent. October was obviously a little bit lower for whatever reason, and let's just say the food re-inspections. But like your 17, 19, 19, 15, and then that one little 13 is a little low, but it is what it is.
Yeah, I was looking more to the variance to the projection column because some of them are like
Hmm.
1,300, 700, 200. Um,
Yeah,
so it just looks kind of funky, but it's not a big deal.
no, I don't think so.
All right, so that was the environmental health report. And then the revenue, we are generating revenue right now from our salon licensing period. The salon licenses are due by December 31st. I believe we have about 20 left, Barbara. Is that right?
Yeah, maybe a little bit less.
Okay. So we're probably halfway done with those. We'll do some reminder calls or emails in the next week or two, and then try to make sure everyone pays before the December 31st deadline. And that is the revenue report.
Okay.
Any questions?
No, everything looked kind of okay to me when I gave it a quick glance over. I didn't get too deep into it, but um, everything looked okay to me. Any other questions by anybody else?
Nope.
No, from my side.
Okay. All right, let's talk some budget stuff, Miss Amy.
So no unfinished business, right?
I don't think there was anything that was really left to talk about from last time. I don't
Okay.
think.
So then the new business, which is the budget preparation. So I sent a draft of what will actually be going to the first selectman. I think it's by January 2nd I have to send it in by. So it is marked draft. The first page is just kind of who we are, our org chart. The second page is our performance matrix that I inherited and then changed a little bit just to kind of reflect where we are currently. So I added the lake samples and the tick testing since those are kind of newer programs that I had started.
Mhm.
And I would like to see those numbers throughout the years. We listed our accomplishments and our goals and our budget highlights. So when you get into the budget itself, we do have some increases this year. Our big increase is from the CHNA, which is the Community Health Needs Assessment. That is done in conjunction with the Health Improvement Alliance, which is a group or coalition of different organizations in the area. And we all fund this Community Health Needs Assessment together for the region. So it's the Greater Bridgeport region. It's done on a triannual basis because that's the requirement for the hospitals. So the rest of us kind of follow that. The hospitals do make up the bulk of it and do the bulk of the work. And then, but we all contribute something based on our per capita to the funding of the actual needs assessment. So that's going to be done during the next fiscal year. So that's why it had to be added back into the budget. We also had an increase in our line for community health. I forget what it's called. Oh, community health supplies, I think it's what it's called. Yeah, community health supplies. That line also increased somewhat significantly. And the reason for that is we've reestablished our child vaccine program. And we are seeing a tremendous amount of children right now looking for catch-up vaccines, either because of COVID issues or because of pediatricians not actually doing them anymore. And by running that program, we do have to have things on hand at all times, such as EpiPens for 2 different weight classes. We have to take care of our sharps, so we do have to pay now for sharps disposal. And one of the requirements is also a logging or in-temp logging system for our refrigerator and our freezer with a notification for when there's any sort of temperature variations. So those costs kind of escalated. And so when I looked at the 1125 and the costs that I knew were coming, I did increase that budget line to reflect the increased cost of that program. To try to offset it a little bit, I did lower our mileage rate a little bit. And we can do that because we're really encouraging any staff who have out of town meetings to use the town vehicles that we have here, because we do have 2 of them. The vehicle expense lines for both the fuel and the expenses are currently blank. The day after I sent it out, Public Works got me my fuel numbers, and I'm still waiting for my expense numbers for my vehicles. Those numbers are generated from Public Works themselves. And so that is an overview of the budget very quickly.
Can I ask what your last name is, Amy?
Lahaney, Lehaney.
Haney. Okay, gotcha. Thank you.
You're welcome. Are there any questions or concerns?
I'm still looking, I'm sorry.
That's okay.
What's your title, Amy?
I'm the Director of Health.
Okay.
Okay, as far as expenses go, everything to me kind of looks okay. Um, you're able to obviously justify the little bit of extra money that you will have to spend for the child vaccine programs and so forth. Um, the questions that I would have at this point are going to be, is there a reason in your revenue side? I'm looking down at like wells and pool, B100As and that sort of thing, and you're projecting to have a significantly lower dollar amount. Was there a specific reason behind that?
Yep. So when we met last month, I had sent and done the revenue projections based on all the years that the health department has been within the town of Monroe, and did the average and the median for all of those.
Oh, right.
Yeah.
Okay.
So we had talked about those before.
Yep. Okay. My old brain didn't remember.
It's okay.
Okay. Does anybody else have any kind of questions for Amy about this?
Nope.
No.
Okay. So the only changes at this point are going to be ones that are given to you by the people for your vehicle costs, you're saying, right?
Right. So I can tell you my fuel cost is going to be $1,058 because he
Okay.
sent me that after I sent it out.
Yeah, I mean that's given to you.
Yeah, that's given to me. And
you
then
can't change that.
the vehicle expenses, I'm waiting for a price on tires so that I can include that for next fiscal year for the cars.
Okay. All right. So I mean at this point there's not there's nothing else to really that's in essence changeable or adjustable. I mean, those two expenses are pretty standard. It's going to be there no matter what we do. Um, so if nobody else has any questions about it, at this point, I will go ahead and move to vote to approve our the budget as put forth by Amy. To go ahead and send it to I almost said Ken, to Terry.
I will second it. Mike will second it.
Excellent, thank you. Lax, your vote.
Aye.
I'm in favor.
Okay.
Aye,
And seeing
Enid.
as though, okay, and seeing as though you put it together, Amy, I'm assuming you're in favor of it.
I'm in favor of it. Yep. I spent
Okay.
some time on it.
All right. All right, good. We're going to go ahead and say that was passed unanimously at this point.
Okay.
Well, that was easy.
We try.
Yeah, you made it very easy. Okay, does anybody else have any questions about anything we have spoke about or any other concerns concerning anything for Amy or the public health people? Lax, anything else, sir?
Nothing from my side.
Okay, Mike, you're all set,
Nothing
buddy?
from the palace.
I'm all set. I don't have any questions right now.
All right, great. Then I guess at this point, we are all done for this month. Um, I guess at this point, unless there is some type of major problem, we will most likely go ahead and cancel the January meeting. But just everybody stay tuned for to your emails to make sure that that is going to be the case. Okay. So I will motion to go ahead and close out the meeting for this evening.
I will second it.
Second.
Excellent. Thank you. All right. Everybody have a wonderful evening. Thank you very much for your time.